Martin, and I'm an ADN student at Williston State College. I am performing my week 13 skill of blood administration. So before we do anything, we're going to take a look at our provider order and verify that he wants transfused 2 units of packed red blood cells now, and then an H and H 1 hour after transfusion. So for this skill, we're going to be doing the 1 unit of packed red blood cells. So I'm going to gather my supplies. You see, we're going to Samantha Lewis's room, date of birth 6/10/1975. She has an allergy to codeine. Okay, and I'm going to have my supplies. Going to get my vitals cart. And knock, knock, knock. Hello, Samantha. How are we doing today? She says, fine, do hand hygiene. I'm going to pull privacy. Okay, so my name's Jessica. I'm going to be your student nurse today. Can you please tell me your name and date of birth? And she says, Samantha Lewis, 6/10/75. And what's your allergies? Codeine. Perfect, thank you. All right, so Samantha, I am in here today because the doctor has ordered that you need to receive 2 units of packed red blood cells. Have you ever had a blood transfusion before? She said yes. I say okay, and so the reason you're getting it today is because your hemoglobin is at 6. So we need to get that up a bit. So here I have my orders, form consent and education. So right here I have a bit of an informational pamphlet for you. It kind of goes over signs of symptoms you need to watch out for. Have you ever had a reaction before? She says no. Okay, so this time, just like last time, we're going to be watching for fever, chills, stomach pain, chest pain, nausea, back pain, shortness of breath, an impending sense of doom. If you have any of these symptoms, I need you to tell me immediately, okay? She says yes. Okay, she understands, so she's going to sign that she received her educational form. And we have the consent form, so the doctor has also explained this procedure. And then I have also explained why we're doing this, and so I'm going to have the patient sign date and time. Perfect. So I can take these. All right, Samantha. Good deal. So I'm going to be doing first is we're going to raise the bed to working height. And I'm going to be taking a look at your IV site. So I can see that we have an 18 gauge IV. So that is exactly what we want, 18 to 20. And I'm going to take a brand new flush. This would be a brand new flush in the package. And you're going to confirm the patency of this IV site. Okay. I'm watching for infiltration. Do you feel any pain? She says no, and I do not see any signs or symptoms of phlebitis, infiltration, nothing like that. And perfect. So the IV site is patent. I would have aspirated a little bit of blood, and then after seeing blood, I would have put the saline in. So, and also because this is a used saline, I'm usually used to opening new package, getting air bubble out, and I would have done that as well because it would have been a brand new thing of saline. Okay, so now we're going to be taking your vital signs. So I'm going to get a full set of vitals, and if anything with that is off, we're going to talk to the provider about reconsidering the orders. So her vitals are fine, and now I'm going to get our tubing and saline ready. So 9% sodium chloride is our normal saline. We are inspecting the package. It is not compromised with the integrity. Taking this out, we know that sodium, normal saline is what is most compatible with giving blood. 250 mils, checking for any particles, discoloration, looks good, expiration date is fine. So then take a look at my blood set. Tubing, I checked the expiration date, it's fine. And then I'm just going to take notes. It says 10 drops per mil. So when I do my titration, we're going to start with 15 to 20 mils per hour for the first 15 minutes, and I would calculate the drop rate for for that since we're doing gravity tubing for this skill. Okay. So, and Samantha, if you need to use the bathroom, this would be the perfect time to do that. Do you need to use the restroom? She says no. Okay. So, I'm going to close all my clamps. Okay. Do not touch these to anything. Going to spike our bag. Okay, perfect. Okay. So now what we're going to do, unclamp this. We need to prime our tubing and get some fluid into the chamber. So we're going to fill our chamber about halfway. Okay. And we're going to unclamp this tubing, this right here. We're getting all of our air bubbles out. And that worked beautifully. Okay. Perfect. So I'm going to clamp that shut. Going to clamp this shut. And this one is shut. So I'm just going to kind of nut here. Cool. Alright, Samantha, we've got your vitals, your tubing's ready, your IV site's patent. Can you please confirm that you know what symptoms to report to me? She tells me what symptoms. I say, okay, here's your call light. Going to take off my gloves, put new, do hand hygiene, stop at the nurse's station, recharge. I'm just going to go be getting my blood for Samantha in room 222. Can you please be here to verify that with me? She says, yes. Okay, great. So I'm going to put new gloves on while I'm there. I'm going to head to the lab. So, I'd also grab a patient sticker from her binder to come with me. Alright, so I come to the lab and the lab tech is there. I have my cross match with me. The cross match has been done. Okay, so with the lab tech, we are going to be confirming we have Samantha Lewis, 10/16/75, medical record number PCS 78500. Blood band ID AFN 3889. We are giving leukocyte reduced red blood cells. Okay, donor number is 120708. PC number is 120708. We have B positive. It is compatible. Our cross match expires 11/30/20. Let's see here. The blood expires. Okay. Well, we're gonna say the blood expires 11/30/20 as well. So everything looks good. Everything matches each other. I'm checking this. B positive. Samantha Lewis. 6/10/75. Perfect. Cross match matches the blood and then the unit tag. Okay, cool. So I'm going to have my gloves on. I'm going to inspect the blood. I'm going to see that there's no clotting, coagulation, anything that shouldn't be there. I'm looking for, compromised integrity. It's fine. So I'm going to carry this very carefully, making sure I'm not shaking it around as I go back to the room. So, knock knock, Samantha. Hello, I am back. How are we feeling? So I'm going to take off my gloves that I used for the blood transportation, and we're doing hand hygiene, putting on new gloves. Alright, so we're pulling privacy. Alright, so Samantha, we are going to have the charge come in. She's going to cross-check all of this with me. Okay, hey charge, Kaylee. So we're just going to confirm with me right now. We're confirming expiration date 11/30/20. Samantha Lewis, 6/10/75. We have B positive blood we're giving. Donor number 120708, room 222. Let's see here. Date of birth, physician Andolin. We have blood band identification. If you look here, AFN3889. You can please confirm that you also agree that those match. And we go through everything that we need to cross-check, cross-match, checks this, matches this, and matches this.
Looks good.
Okay, thank you, charge. I appreciate it. All right, so now that we're done with that, I'm going to go ahead and get ready to administer the blood. Not a breath. So, make sure this is clamped. That's ready. And before we do this, we're doing our very last check. I am checking blood band number, patient name, date of birth, medical record number, blood band ID, name and date of birth. Name and date of birth, thank you, you give me that. Your allergy to codeine. Donor number, blood type B positive, compatibility, cross-match expires, blood expiration date, those were both checked. Donor number and everything else checks out. Our third blood check is done. So now, we can spike our blood. Alright, so we are starting, we have this clamped, and we're going to prime this, get our blood into the chamber. Perfect. Okay, so we're going to be titrating this to 15 to 20 mils per hour for the first 15 minutes while we wait to see if there's any reaction to the transfusion. And then after the 15 minutes is over and we are clear of any possible reactions, we will open this back up and we will calculate the rate we need for 150 to 300 mils per hour to be transfused over 4 hours. The transfusion will not go over 4 hours. So this is ready. I'm going to hook this up to the patient's IV. We've done our 3 blood checks. We have confirmed our patient's date of birth, identity, and allergies. We have her vitals. We have kept sanitary. And we are ready to go. I will unclamp this, and okay, I'm going to stay in the room for 15 minutes and watch for any symptoms or reactions. The patient knows that she needs to report any symptoms of a reaction to me. And while I'm watching for this, I confirm that we have a drip rate, and at the end of 15 minutes, I'm going to take her vital signs. Her vital signs are fine, and this is when I will titrate our mils an hour to higher to complete in the next 4 hours. So I'm going to take off my gloves, do hand hygiene, remove privacy. Here's your call light. Samantha, can you please use your call light if you need anything or start having any symptoms? And she said yes. Okay, so I got my second set of vitals, and I'm going to go chart everything according to policy while I wait for the transfusion to finish. And I'm going to be checking up on her every 15 to 30 minutes to make sure everything's going fine. So, I know that the transfusion is almost done, and she puts her collar down to also let me know. So I knock. Hello, Samantha. It's Jessica. How's it going? She says good. Okay, awesome. So we are going to clamp the blood, and we're going to do a quick assessment. Looks fine. Allergies, name, date of birth. She confirms those for me. See here, the blood has all been administered. So now we are going to be flushing the line with the normal saline. So I've closed this, opened this one, and this is going to be flushed until, you know, obviously there is no more blood in the line and no more blood right here. We're going to flush that thoroughly. And after that is done, what we do is clamp this. You're going to take our IV in right here, our tubing off. And how we're going to dispose of this is according to facility policy. Blood products are a hazard, biohazard, so this will go into a biohazard bag and put in the correct placement per policy of the hospital. Okay, so now we're going to get your third set of vitals. I get those, and it looks good. She looks good. She's doing great. She's had no reaction this whole time. Okay, so now I'm going to go call the lab. They want to take an H&H 1 hour after your transfusion is done. So I'm just going to note the time and go let them know when they can come up. And we will later be doing your second unit of blood. So I'm going to take off my gloves. This has all been disposed of. So we'll kind of go through the motions of have been thrown away. And in biohazard, here's your call light, do hand hygiene, bed's low and safe, doors are locked. Just make sure she's comfortable, she doesn't need anything. Remove privacy. I'm going to go to my desk. I'm going to chart everything that I did, the mils per hour, going to chart all of my checks, going to chart the vitals, make sure to put the consent form in the charting, chart who checked all the blood with me to make sure it's the correct blood to administer, and everything else needing charted for facility policy. That's the end of the skill.